Hi, my name is Glenn Esslinger. I'm 65 years old, now a retired registered nurse. I first met Dr. Nezami several years ago. We worked at the same place and rubbed shoulders with him there on occasion. And after he left the place, I brought my wife to see him for her adrenal issues that she was having, and he corrected that. And since I've been diagnosed with pancreatic cancer, I did make contact with him, and one of the first things he told me was, do not take any chemo. And I was inclined to do a clinical trial, but I didn't qualify for that, so I made contact with Dr. Nezami again, and he put me on a 10-day, 2-week treatment plan that would prep me for my initial chemo therapy. And we've been doing this now for I don't know how many weeks, really. 6 weeks probably. About 6 weeks. I am seeing him twice a week in conjunction with my chemo. And my markers have all come down. My HER2 marker has dropped from 17 to 9, I think is what it was. It might be 7, I'm not sure, but it's had a significant drop. So as it stands, I'm pretty satisfied with what's been going on. The only side effect I've had from chemo has been hair loss. No blisters in the mouth, no nausea, no vomiting, no diarrhea. So he's kept that all at bay, and I just need to grow my hair back. All in all, it's been a good treatment, and I seem to be getting a positive benefit from it. So some of the blood work that Dr. Nezami does is to see whether or not the chemo that's going to be prescribed is the appropriate chemo for the cancer tumor that he is addressing. And he will also do a blood work in which to see if there's any floating cancer cells floating throughout your circulatory system. Initially I did have some, but we did a subsequent follow-up a couple weeks later, and that test showed that I no longer had any T-cell activity in my circulatory system. So I was happy to see that. So if you're looking for someone to go a little bit farther and beyond what the standard chemotherapy is, you might ought to give Dr. Nezami a call.